celiac disease, gluten intolerance, and wheat allergies. There are several medical conditions that are linked directly to gluten. One of the most well-known is celiac disease. You may see celiac spelled two different ways. Both are correct. To help you remember the pronunciation, think of celiac. The word celiac comes from the Greek word for abdomen, and originally described pain in the belly. In the 1940s, a Dutch doctor named Wilhelm Dijke realized that the removal of some grains from the diets of children with digestive issues greatly improved their condition, thus discovering celiac disease. Celiac disease is an autoimmune disorder where a person's immune system attacks their own body. Before we explain celiac disease, let's look at how the immune system works. Chickenpox is a common disease that most people only have once. Once someone has been infected, or gotten the vaccine, they do not get chickenpox again, even if they are exposed to it. This is a good example of how our immune system works. The first time you are exposed to the chickenpox virus, your body does not have any defenses set up to fight it. The virus begins to multiply in your body and you get sick. Your immune system quickly goes to work and creates specific antibodies that are able to fight off the virus. Initially, there are more virus cells than antibodies. Your immune system soon catches up and makes more and more antibodies. The antibodies destroy the chickenpox virus and you recover. Over your life, you will be exposed to the chickenpox virus again and again, but you will not get sick. This is because your immune system keeps a few of the chickenpox antibodies on hand. If you are exposed to the virus again, your immune system remembers and quickly makes more antibodies to destroy the virus before it can multiply and make you ill. Celiac disease works in a similar way, but the immune system mistakes the gluten protein in foods as a virus. Instead of recognizing gluten as a food and nutrient, the immune system thinks it is a dangerous invader. We are not sure what triggers the body to make this mistake the first time, but once it starts, the body continues to make antibodies to destroy gluten. For most viruses, exposure is infrequent, maybe once or twice a year. But think for a moment about how often the average person consumes a food containing gluten. Gluten is often a part of breakfast, lunch, dinner, and dessert. There are a few problems with this mistake. Most of the antibodies that destroy gluten are found in the small intestine. The small intestine is covered in finger-like villi, which help absorb nutrients from food. When antibodies attack the gluten, they injure the villi. Damaged villi are short and blunt, and are unable to absorb the nutrients that the body needs. The other problem is that the presence of these antibodies often causes unpleasant symptoms. For many people, it feels like having a bad flu. There are over 300 recognized symptoms for celiac disease. This makes it more challenging to get a proper diagnosis since many of the symptoms are similar to other conditions. The most common symptoms are gastrointestinal, but symptoms can occur anywhere in the body. Other common symptoms include mouth ulcers, joint pain, eczema and skin rashes, anemia and vitamin deficiencies, headaches, and mental suffering. The symptoms may not appear immediately, and some show up many hours after eating gluten. There will be a full list of symptoms and medical information in the download section of this lesson. Another related condition is dermatitis herpetiformis. This is also referred to as DH. It is a chronic, intensely itchy, blistering rash. It is the skin manifestation of celiac disease. The rash usually occurs on the elbows, knees, scalp, back, and buttocks. The bumps and blisters resemble the herpes lesions, hence the name herpetiformis. But they are not caused by the herpes virus. Rather, they are caused by gluten ingestion. DH is often misdiagnosed as eczema. To get a proper diagnosis for celiac disease, the first step is to visit a specialist who is familiar with the condition. This is often a gastroenterologist or dermatologist. The doctor will order a blood test that will look for very specific antibodies to gluten. If the results are positive, the doctor will do an endoscopy at the hospital to look for damaged villi. Right now there is only one effective cure for celiac disease, which is to permanently eliminate all gluten from the diet. There are no drugs, vaccines, therapies, or alternative treatments. The immune system will remain responsive to gluten for life. A strict gluten-free diet must be adhered to all times. No cheating. It only takes a tiny amount of gluten to activate the gluten antibodies. Some people test negative for celiac disease, yet still experience unpleasant symptoms when they eat gluten. This is often described as gluten intolerance, or gluten sensitivity, or non-celiac gluten sensitivity. For this course we will use the term gluten intolerance for all three conditions. The symptoms of gluten intolerance are similar to celiac disease, including abdominal pain, bloating, gas, diarrhea, foggy mind, lethargy, fatigue, and more. And like celiac disease, symptoms improve when gluten is eliminated, and return when gluten-containing foods are reintroduced. However, unlike celiac disease, gluten intolerance does not appear to involve the immune system, or damage the gastrointestinal tract. Currently, there are no reliable medical tests to detect gluten intolerance. It is typically diagnosed by ruling out celiac disease. Gluten intolerance is still a very serious condition and can cause considerable discomfort. A true wheat allergy is a little different than celiac disease, or gluten intolerance. A wheat allergy is more similar to a peanut allergy. It is an immediate allergic reaction that is triggered by wheat. The allergic response often starts with hives and swelling, an increased heart rate, sudden digestive distress, and occasionally difficulty breathing. A wheat allergy doesn't usually cause anaphylaxis, but it is possible. It is very serious. If someone is having an allergic reaction to wheat, call an ambulance, and get them to the hospital immediately. If you believe that you have celiac disease, gluten intolerance, or a wheat allergy, please consult with your doctor or medical practitioner. It is extremely important to complete proper testing and diagnosis before beginning any kind of treatment. Starting a gluten-free diet before being properly tested can complicate the diagnostic process. Once gluten is eliminated from the diet, the antibody testing will no longer be reliable. The only way to accurately test for celiac disease is to resume eating gluten again. A knowledgeable healthcare provider will be able to help navigate the testing and the diagnosis of a gluten-related disorder. For further information about testing for celiac disease, gluten intolerance, or wheat allergy, you can download the PDF on gluten-related medical conditions in this lesson.